Welcome to today's webinar. County Health Rankings and Roadmaps is a program of the University of Wisconsin Population Health Institute with support from the Robert Wood Johnson Foundation. This webinar is produced in collaboration with Healthy Places by Design. The University of Wisconsin-Madison occupies ancestral Ho-Chunk land, a place their nation has called Dejo since time immemorial. Today, UW-Madison respects the inherent sovereignty of the Ho-Chunk Nation, along with the 11 other First Nations of Wisconsin. This webinar will be recorded. All speakers' views are their own. Guest bios and slides from today's webinar are available on our resource page. We will share a link to the resource page when the webinar begins. Stay up to date on all things CHR&R. Find us on Facebook, Twitter, and LinkedIn. And if you haven't already, sign up for our newsletter by scanning this QR code with your phone's camera. It's the best way to find out about upcoming webinars, our podcast, and our latest tools and resources. Your facilitators today include our host, Erica Burrows-Girardi, with support from CHR&R Communications Specialist, Tommy Jaime, and the Collaborative Learning Director from Healthy Places by Design, Joanne Lee. We invite you to continue the conversation immediately after the webinar in our discussion group. Joanne Lee will be our lead facilitator. And watch for a chat from Tommy for details on how to join the group after the webinar.
Welcome to Making Social Connections for Community Health. Hi, my name is Erica Burrows-Girardi. I am the Senior Outreach Specialist at County Health Rankings and Roadmaps, and I'm so excited about this webinar in which we will be exploring what's behind social isolation and opportunities to create connection and belonging. You know, when I started my public health career over 20 years ago, y'all know I don't like to say that total, but anyway, over 20 years ago, I never would have imagined that I'd be talking about social connection and belonging in the context of health. Fortunately, public health has evolved, and as a result, this is one of the values that County Health Rankings holds and builds its work upon. Health means the collective well-being of living beings and the earth. We recognize and embrace we are connected and linked to one another. So what this means is that our collective survival compels us to create space for social connection and extinguish social isolation. So I want you to keep that idea in mind as we move through today's webinar. And with that, I want to introduce you to some co-producers who's going to aid in your learning experience. And I will let you know, it's thundering here right now. This is an occurrence that happens every every afternoon around this time in July and August. And those of you in the audience from Florida, I know Aaliyah is out there in the audience. You all know this is what happens this time of day. So I am going to start with introducing you to Joanne, because if something happens, Joanne is going to take the lead. So Joanne Lee.
Well, you know, Erica, you can never be replaced, but I am here at the ready in case weather does not cooperate today. But hello to you and everybody in the audience today. So glad to be here for a really interesting topic. My role during the webinar today is going to be to monitor the Q&A box. So I want to encourage everybody on the webinar to go ahead, open that Q&A box, and as questions come to mind, feel free to post them in the Q&A, and I will be keeping a list and sort of triaging the most common questions and ones that we think we can address during the time that we have during today's webinar. And I'm also looking forward to seeing some of you in the post-webinar discussion group, and you'll hear a little bit more about that in a minute. But right now, I want to introduce you all to Tommy Jaime with CHR&R, and Tommy's going to be engaging with you all via chat, and he'll tell you more about that. Hi, Tommy.
Hey, Joanne, thanks. And hi, everyone. I'm excited to be here with all of you today, and I will be the one chatting with you in the chat box today. So if you choose to use the chat feature, please remember to use the drop-down box and choose chat to everyone before you send your message. And then that way everyone can see the chat. And if you have a question, like Joanne just said, please be sure to place it in the Q&A box where she'll be able to help you out. And then next up, I'd like to introduce Erin Schulten. Erin is a colleague here at County Health Rankings and Roadmaps, and she's going to be helping with technology today. So if you have any tech issues during the webinar, please let us know in the chat, and Erin would be more than happy to help you out. Hey, Erin.
Thanks, Tommy. It's always good to be here with everyone. Like Tommy said, if you have any trouble seeing the slides or hearing the sound, please let us know in the chat and I'll see what I can do to help, unless it's a weather issue, because I cannot help with that. I will now pass it back to our producer, Erica.
All right, it's not going to thunderstorm. I will not lose internet connection. But anyway, thank you so much to my production team who's actually going to step in the gap should something happen. So you're in good hands. But, you know, social connection and belonging means being included, and included physically, emotionally, and spiritually. When we experience strong social ties, we thrive. The science of social connection and its inverse, social isolation, is evolving, and the evidence is pointing to the fact that social connection and belonging are critical ingredients to health and well-being. And this evidence is actually growing stronger. So, what is the evidence showing us? Well, we now know that strong social ties lead to a longer lifespan. How about that? Belonging and inclusion lead to greater participation in the social and political structures that influence norms and policies. So, in other words, we find our voice when we feel included. We're empowered to act, to advocate, and to participate civically when we are included. But what happens when we are not included? When we don't feel like we belong? What happens when we are socially isolated? Well, the science is telling us that social isolation has many consequences, and we're going to hear about a number of them today. But one of the consequences of social isolation is that it can lead to stress that has a physiological fight or flight response. And that can ultimately lead to poor health. And sometimes the response to this stress is to cope with it in harmful ways. So we have these harmful coping mechanisms that again ultimately lead to poor health. So that's why today we're going to explore these questions and more with our expert panel. We're going to ask this question, which I think is a great one. What's the difference between loneliness and social isolation? What are the root causes of social isolation? And who's more likely to experience it? Most importantly, we're going to talk about how can we create opportunity for residents to connect and belong. So I'm really looking forward to digging in on this topic. And I want to start by introducing you to our panel. And I will start with Edward Garcia, who is the founder and executive director of the Foundation for Social Connection and is a partner with Healthsperian. Welcome, Eddie. I know that's what you the name you prefer. Can you tell us a little bit more about the foundation and his Healthsperian?
Yeah, absolutely, Erica. It's really wonderful to be here, and thank you all for having me, truly. So I'm here representing a number of organizations shown on the next slide that, starting from the left to the right, looking at the first three, excuse me, they work together and focus on raising national and global awareness around social isolation and loneliness. They advocate for global, national, and state policy reforms, and they support the translation of the evidence base into real-world solutions. The fourth circle, the dark blue, represents a partnership between my organizations and Healthy Places by Design, which is Risa will talk about shortly, which supports community and local leaders in their approaches to tackle social isolation and loneliness. Across all of these organizations, Healthsperian, of which I'm a partner, serves as an engine supplying staffing and technical support through its healthcare and social services consulting practice geared toward transformation of our systems, serving the most vulnerable among us. So that's where I'm here representing today.
You're one busy man. Can I say
Yeah.
that? But thanks, Eddie. We are certainly looking forward to hearing more from you. And let me tell you, this guy's chock full of knowledge. Yeah, I can't wait for you to hear what he has to say. But now please help me welcome our dear friend, Risa Wilkerson. Risa is the Executive Director of Healthy Places by Design, which has been a longstanding partner with County Health Rankings and Roadmaps. Welcome, Risa, and can you share a little bit more about your organization's role in informing the public health community about the importance of social connection?
Sure. Hi, Erica, and welcome everybody. Thank you so much for being here with us and for inviting us here. As many of you know, Healthy Places by Design advances health and equity by partnering with health-focused funders and other nonprofit organizations like the Foundation for Social Connection. We provide technical assistance to community leaders and coalitions. We coordinate collaborative learning networks. And in our partnership with Eddie's team, we bring our 20 years of place-based work together with their work at multiple levels, national and global and others, to strengthen social connections across all those continuums. As far as how we got into this work, I mean, we've long centered our community action model on trusting relationships. And then in 2020, we organized and led a learning network for Robert Wood Johnson Foundation grantees and others who were working to reduce social isolation. And as the pandemic throttled their original strategies, most of which required in-person gatherings or activities, the conversation quickly turned from an individual lens, or getting people together, to addressing the root causes and creating structural changes within communities to make it easier for people to be socially connected. So our report from that initiative, called Socially Connected Communities, Solutions to Social Isolation, which is, by the way, included in the resource guide for this webinar, describes why and how this needs to be a public health and local community issue.
Yeah. And let me tell you, that report, I read that report, and it's one of the reasons why I reached out to Risa and Eddie to have them join us on our webinar platform, because the report is just amazing. So do look out for it. That resource guide will be shared with you tomorrow. And as you can tell, folks, this is going to be a really informative webinar. And, you know, we want to invite you to that discussion group that you heard about during the intro, and Joanne touched on it as well. These discussion groups are facilitated by Joanne. They're very engaging. It gives you the opportunity to share and learn from others. So please plan to join us. At the end of the webinar, Tommy's going to chat out a link for you to join, and Risa and Eddie are going to be there in the discussion group as well. So I look forward to joining you in that discussion group after our webinar. So, Risa, I want to turn to you because this is such an important question. It's one of the things that people get kind of confused about. What's the difference between loneliness and social isolation?
Yeah, thanks. People do often talk about these two terms as though they are one and the same, but they are different. As you can see by the definitions that are there on the screen, social isolation is an objective measure. It's having few social relationships, social roles, and group memberships, and infrequent social interaction. Whereas loneliness is a subjective, unpleasant, or distressing feeling of isolation. It's a perceived discrepancy between one's actual and one's desired level of social connection. The conflation of these two terms is linked in the ways that social isolation is often defined, discussed, and addressed primarily through an individual lens rather than a systemic one. And so I think that one way to see how this actually plays out is when you hear the terms hermit or loners. Author David Sue mentions that people tend to label socially isolated people in this way. And when you hear those terms, you can tell that it sort of frames isolation as largely a consequence of individual choices, failures, or traits. But social connection, on the other hand, is a term that refers to the structure, function, and quality of relationships with others. And it includes not only the size and diversity of one's social networks and roles, but also the functions that these relationships serve. And the good news is that people living in socially connected communities are more likely to thrive because they feel safe, welcome, and trusting of each other and their government. And these trusting, meaningful relationships enhance our mental, our physical, and our emotional health and well-being. And as you can see by the data point on the screen, social connections and networks can boost our lifespan by 50%.
Yeah, that is amazing. I tell you, that was the one thing that said, oh my gosh, I really want to bring this to light on a webinar when I saw that statistic. And so, Eddie, let's talk about some more of the data that we see around social isolation. That is really hard for me to say,
It
folks.
is.
So, listen, if I mess up, just I appreciate your grace. But but social isolation isn't new. Why is it emerging as a public health crisis now?
Yeah, and it's incredible. As Risa just said, the stats on social connection and how positive they are to our health and outcomes. There's the corollary on the opposite side of social isolation and loneliness. So unfortunately, this has been a long-standing public health crisis that many are just learning about because of the pandemic. Millions of Americans are socially isolated, lonely, or both, even before the pandemic, which negatively impacts quality of life and health outcomes. This may have worsened in recent decades, with indicators like more people living alone, and decreased involvement in community groups. Social isolation has been associated with a number of significant co-occurring conditions, such as chronic lung disease, arthritis, impaired mobility, the list goes on and on. Even premature mortality, which at the same risk levels as smoking and obesity, excuse me. Here I listed out a number of other physical, mental, behavioral, economic impacts and cognitive health. These high rates of disconnection cost employers in some studies, $406 billion in additional spending, and the Medicare program, nearly $7 billion in additional spending every year. And this goes well beyond older adults. Youth, young adults, middle-aged, and other individuals can experience social isolation and loneliness too. Currently, Generation Z is reporting the highest rates of loneliness in the US. Reasons could stem from increased use of technology, according to certain research, and of those that heavily use social media between the ages of 19 and 32. They're reporting higher rates of social isolation and loneliness. However, there are many, many policies, systems, and structures, which we'll dive into, that create barriers to social connection.
Yeah, we need to do that. Who experiences social isolation, and are there populations that are more likely to experience it at higher rates? You talked about Generation Z, but let's talk about some others.
Yeah, absolutely. Definitely. So this list here is just a reference for you all. So please take a look. Now, please close your eyes for a moment. Think about someone you know that had the following life changes or experiences in this list. People who are most susceptible to social isolation and loneliness are those who feel that they don't belong to the majority social groups because of their gender identity, race, ethnicity, or sexual orientation. These groups are the highest risk of both acute and chronic social isolation and loneliness, and they have the worst health and well-being outcomes.
Yeah, that makes me so sad, Eddie, but we need to learn. So thank you so much for bringing it to light. Risa, what are the root causes of social isolation?
Yeah, this is the really important point here. So what Eddie shared about who experiences this and how pervasive it is why we say it's not a personal choice or an individual problem, but rather is rooted in community design, social norms, and systemic injustices. In the US, we can look at a variety of historic policies to see how this is so.
So you're describing an equity issue. This is clearly an equity issue, right?
Absolutely. Absolutely, it is. I think that's really clear. When you look at the underpinnings of these root causes, we can see the inequities, and we know that we must provide resources and equal opportunities to correct them. So social isolation, as Eddie mentioned, disproportionately impacts groups of people who are commonly marginalized, treated as others or oppressed, which of course includes Black, Indigenous, people of color, LGBTQ+, those living in low-income neighborhoods, people experiencing homelessness, incarceration, unemployment. And so unless our solutions to social isolation are centered in inclusive and anti-racist, anti-other approaches, we know that greater inequity is a probable consequence.
Yeah. Um, Eddie, Risa mentioned historic policies. What are some policies that have contributed to certain populations being isolated, even if it wasn't meant to be, even if it's unintentional?
Yeah, absolutely. And I'll mention in the chat and seeing there are many more groups here that are at higher risk. So thank you for everyone highlighting those. For sure, we agree. So to answer your question, Erica, we can look at how systems are designed to find these answers. This is just a partial list here of systems that have been designed both intentionally and inadvertently. in ways that lead to isolation and oppression.
Mm.
For example, the US was founded on the seizure of 1.5 billion acres of native land and the intentional erasure of Native American culture through forced assimilation into white culture. I identify with that experience from my Cherokee Indian Native American history. Public policies such as redlining have created racially segregated neighborhoods, isolating minority students in poverty-concentrated schools, where students of color face racial bias in school discipline, isolating them through disproportionate levels of suspension, expulsion, and removal from the classroom, as another example. Highway development intentionally split communities of color, resulting in a legacy of severed social networks and polluted neighborhoods. And most recently, we are seeing policies developed at the state level in schools that are forcing LGBTQ youth into social isolation and loneliness due to their gender and sexual identities.
Yeah, and I would also add, we think about transportation. It is also related to alternative travel options like bicycling and buses, which are stigmatized, quite frankly. And the related investments often bypass low-income communities that would benefit from those the most. And then also, another group of formerly incarcerated people often and also experience significant barriers to opportunities such as education, housing, and jobs that, quite frankly, have the potential to help them strengthen their social connections once reentering.
So true. So how do we then take a population health approach to reducing social isolation and strengthening social connections? In other words, how do we align this with our collective work to create greater health and well-being for all?
Yeah, well, I would start by saying that we can take heart that this does not have to be addressed as an independent issue or a separate lane of work. I mean, we have so much we're all trying to do already that is an overwhelming idea, but rather we should integrate this into every sector and every issue area that we work on. And I hope people are already starting to see how naturally that could happen. I like the quote shown on the screen. Where we talk about connection building a virtuous cycle. So when people feel more valued and cared for in a community, they're more likely to be civically engaged and to participate and to help to create these healthy, equitable places that we're all talking about. And then once they're engaged like that of course cycles back to feeling more connected again and on and on. But Eddie, would you like to share a little bit more about how sectors can contribute?
Absolutely, thank you. Yeah, so as Risa mentioned, the Foundation for Social Connection has created something called the Social Connection Framework. And here we're really looking at how do we bring together a systemic approach to addressing social connection. So first, we have placed people at the very center, the individual and the broader population communities we are seeking to serve at the very center of what we do. Then we look at levels of impact. So depicted in green, this illustrates the individual, the interpersonal, institutional, community, and societal levels of a public health sociological model. Then we overlay those sectors of society. So depicted here in blue, it illustrates the sectors included within the Health in All Policies model developed by the World Health Organization and the CDC. And in gray, we see opportunities for collaboration across those sectors, which acknowledges and encourages approaches that are interdisciplinary. Some cross-cutting themes that we highlight, depicted here in gold, illustrate areas of focus such as lifespan, diversity, equity, and inclusion, and of course, underpinnings of evidence behind this model that span across all levels and sectors represented in the framework. This can be used to apply cross-cutting themes and identifying gaps and opportunities.
Okay, yeah, let's talk a little bit more about the framework.
Yeah, thanks. So we really want this to be actionable. And we're hoping this is a tool that you all can use. So here's some steps that we recommend for that. So first, looking at the sociological model, think through how this might enable you to take a systems approach and identify areas to expand efforts or fill gaps in your own approaches today. Second, we of course want you to think about your own mission, your own personal missions, but also those of your organizations and your communities. How might taking a systems approach elevate or expand that collaboration and that impact? Of course, we really want people to consider the lifespan. Many of us get stuck on certain populations at one point in time. We like to think about a lifespan approach because it allows for prevention and treatment in our approaches. And then finally, of course, considering inclusivity. It's very important to us that we look at disparities in care and using this model to highlight where those disparities exist.
Nice. Now, there's some examples that I really wanted you to include in here because these are examples that folks in the audience can actually do. So share some of this.
Yeah, and I really appreciate it. And some of these examples are coming from our work with the CDC's Building Resilient Inclusive Communities project
Okay.
that both Risa's program and myself were technical assistants on. So what we highlighted is just some examples, some policy changes that can be taken are provisioning county or city public lands for green spaces or farmers markets, or passing a law allowing residents to plant community gardens in vacant lots. Some system changes approaches. Our examples are creating a community plan to account for social health impacts of new projects, or developing a referral system in local hospitals to help patients access further social connection resources and programs. Some environmental approaches can include incorporating spaces specifically designed for gathering into your communities or into your organizations, or co-locating adult and child care centers or senior centers within schools.
Yeah, I like that. I mean, I remember we had a former director, Julie Williams Van Dyke, who always used to say health is local. And those are like some practical local things that can be done that's within the PSC space. So thank you so much for those very practical, doable things. But
Yeah.
now, what are some of the national policies that we should be keeping our eyes open for because they can influence state policies or help inform more local policies that support belonging and social connection. So let's talk about some of those national things.
I appreciate it, Erica, because these are opportunities that we believe will be coming down the line from federal policy that we're advocating through the Coalition on Social Isolation. So I wanted you all to be aware of them. So we're advocating for establishing a nationally coordinated response to address social isolation and loneliness across our federal government and all sectors of the departments. So more to come there. We're advocating to expand access to behavioral health through Medicare and Medicaid and enforcing mental health parity laws. We're advocating to increase access to social determinants of health broadly and how social connection is an underpinning of all social determinants of health. We're advocating to direct funds for public health at the state and local levels, so to all of you, including supporting schools and CBOs, to address the evidence base through additional funding research to figure out what works and what doesn't work. And then finally requesting some government studies to conduct a comprehensive governmental-wide study on what's being done across the federal government and how to leverage more resources.
Great. I love it when there's sort of like some policy behind the work that we're doing because that's what makes it sustainable. So, Risa, are there examples of state and local policies that are building social connection that you can share?
Absolutely. Yeah, lots of them. And I bet that many in your audience are already coming up with some or have some they could be sharing as well. But we'll talk just briefly about 3 areas right now that are lifted up in the report we mentioned earlier, which is public spaces, housing, and transportation. So we recommend that communities co-create inclusive, healthy public spaces that encourage social interaction. For example, designing safe spaces for all ages to gather and encouraging intergenerational exchange, such as Addie mentioned, co-locating important destinations and services. We also think we should decriminalize loitering and enable more innovative use of parks and public spaces. So an example, in Rochester, New York, they adjusted their policy to permit the use of winter fire pits in parks. And as you can imagine, in cold winter months, that helps people stay outside and hanging out together a little bit longer. We know several US cities, including Atlanta and New York City, have adopted sort of ciclovías or Sunday parkways, a practice started in Bogota, Colombia, of closing off certain streets to motor vehicle traffic to create safe and inclusive spaces for people to enjoy a range of outdoor activities. And when they speak about that particular activity, they always talk about how that helps to bridge social connections across neighborhoods or, and the diversity of the residents in those communities. And final example in this particular space I'll mention is, in 2020 during the civil unrest following the murder of George Floyd, dozens of cities removed or renamed more than 160 Confederate monuments and memorials whose presence glorified a slaveholding past and disenfranchised and alienated Black Americans. Many of these cities are now working with their residents, which of course helps to improve social connection too, to consider how best to replace these monuments and create public spaces that are welcoming and respectful to all.
Let's talk about transportation.
Yeah, thank
I'm
you.
sorry.
Yeah, no, that this is another area, and those in the transportation world will recognize the term people first. So we really urge transportation planners and decision makers to think about movability of people, not just motorized vehicles, with walking and bicycling networks and other supports like transit service and lowering traffic speeds and air quality control. One example called Play Streets, which I'm sure some on the call likely have in their communities. These are city-owned streets temporarily blocked to create cars for recreation and physical activity. But wherever we can find those multiple purposes or, addressing multiple issues is really important. And in some cases, Play Streets double as summer food service sites. So you can really imagine people coming together, for all those reasons on Play Streets and connecting with each other. As a global example, we've learned that some Swedish cities implemented gender balanced budgeting. They did some research and their data showed that women are often more impacted by snow clearing practices. And because they're more likely to walk and often taking children to childcare, the local government prioritizes now childcare centers and schools first for snow clearing.
Yeah, that makes a lot of sense. And some of you in the webinar that live in those states where you accumulate a lot of snow in the winter, you could definitely appreciate that policy. Hopefully you have one there locally that's similar. Risa, what's happening in housing?
Well, housing, is another great opportunity to think about how you bring people together and gather people. So we encourage local leaders to strengthen and safeguard inclusive, affordable housing through zoning and other design measures that can help residents gather and make those social connections. For example, housing first strategies include wraparound supports, connect people to social supports and folks that can help them, access resources, and then co-locating parks with affordable housing, again, is another way of thinking about the design that would strengthen social connections. Mixed use, mixed income housing that can bring people together in commerce too.
Yeah, yeah. Eddie, many of us belong to multi-sector partnerships, especially those of us on the call. So how can partnerships take steps to ensure that our communities are socially connected and, create that sense of belonging for all residents?
Yeah, well, certainly, as everyone here knows, at the core of any social solution that takes equity to heart is the need to empower those being served to serve themselves. With this in mind, it's imperative that the social connection strategies are rooted in local collaborations that are responsive to locally articulated needs. In other words, meaningful community engagement of residents shifts power and creates opportunities for connection in themselves. One suggestion to kickstart efforts is that organizers can work with residents to map the structural, systemic, and artistic and cultural assets of their cities, towns, and states, and tribal communities, with a focus on the cultural resources in communities of color and low-income communities. Every aspect of community life can either enhance or suppress social well-being. All sectors have a role to play, as we've been articulating. When community leaders pair a social and all policy framework with approaches that are culturally relevant, gender inclusive, and trauma and resilience informed, they demonstrate what their community values, its people. These efforts help improve trust between residents and leaders and open the door for conversations about a future where everyone has the potential to experience absolute belonging and social well-being.
Yeah, I love that, creating those community norms where social connection, it just becomes who you are, as a community. So I love that. Eddie, this body of research is so meaningful and exciting. How can we deepen our learning and gather peer support as we think about taking action to create more social connections and belonging for people?
Yeah, it's a great question. And again, I've pulled together some tips here that we pulled from our work with the CDC's Building Resilient Inclusive Communities that we shared, that we pulled together across the 20 state departments of health that were running those programs. So I wanted to share those here. So tips for overall success: build partnerships within the state and your community. With multiple entities caring about the issue, there is now a diversified pool of funds and programming to sustain these efforts. And make that culture, make it the culture of your organization and prioritize social connectedness within your culture. Tips for enhancing representation: you can think through a diversity, equity, inclusion lens, of course. Work with local organizations focused on populations who experience social disconnectedness itself. Capture diverse views through focus groups, interviews, and surveys to assess what the views of those communities are. I've seen many in the chat already talking a bit about this, so I'd love to hear more discussion later about that. Tips for intergovernmental partnerships: reach out via email or other forms to contacts within departments of health, within departments of human services. Really look towards your AAAs, the area agencies on aging, to begin fostering a relationship. So there was an example in Mississippi where this happened, to consider taking a lead and convening with these partners as well. You can also develop cross-agency trainings or webinars to educate department members on the variety of issues on social connection from your perspective.
Yeah, I love those tips.
Yeah,
And
so I think we also wanted to highlight opportunities and disparities between rural and urban, and older and younger populations. So some best practices that we learned there for rural communities, to set small goals. For example, measuring a 25% increase in access to programs across communities is one approach. You can also build partnerships with rural stakeholders like churches, hospitals, and other anchor institutions within those communities. You can work with the federal government, and Lifeline programs, to partner to expand broadband and connectivity services to those in need, and to work to implement technology training in communities. I also saw that in the chat. Regarding seniors, you should connect with your Department of Aging and Medicaid departments. Those are important to expand access to coverage for those populations. You can meet seniors where they are and offer solutions based on their lived experience. Listening can create a trust and lower resistance, of course. I know many of you know that. Or adopt social isolation mitigation plans for seniors living in facilities. This is something that New Jersey did, which creates opportunities to transition older adults to the community through referral programs. And integrate with other programs seniors know and trust, like Meals on Wheels or faith-based programs and Silver Sneakers.
yeah, Risa, what would you add to that?
There's so much already good there, and it sounds like so much coming in from the chat that we can't wait to hear a little bit more from all of you. But first, I would just say host conversations in your own community. You can use the resource guide package that will be part of this webinar. Our report, Socially Connected Communities, and the Foundation's social framework are two great resources. It sounds like lots of other resources are coming in as well to be considered. Next, I would integrate social isolation connection into community health needs assessments to gain a better understanding of how all this plays out in your community. Like, it's all about your community and what is happening with the residents in your community and understanding that better, right? And remembering to think about how social connectedness gets integrated into your existing work, and then adopting social connection metrics into your policies and programs. And finally, I think it's important to stay part of a learning community, continue this conversation that we're having today. Healthy Places by Design has engaged a peer network of local government, community, and philanthropic leaders that meets monthly. Next week is our next one. And this group explores concepts, ideas, and community level strategies that reduce social isolation and strengthens social ties, especially for those who are most marginalized. And if you'd like to learn more or to join, it's free. You can email my colleague. Her email address is there on the screen. And then, Eddie, would you share about the National Network of Champions?
I'd love to. Thanks, Risa. So the Administration for Community Living under the U.S. Department of Health and Human Services started a campaign, a whole program called Commit to Connect about a year ago. Under that program, they're seeking to raise national awareness through online and other media outlets, to create a battery of evidence-based practices and solutions that can be deployed across the country at scale. And then they've also created something called the Nationwide Network of Champions, which is meant to be bringing facilitation of organizations across the country, some like yourselves, that can engage in deploying these solutions and receiving best practices and support from this federal effort. There's an opportunity for everyone to get involved in that work, and happy to share more information about how to get involved with that after the webinar.
And you can also make sure that Joanne has it, and she'll make sure it's in the resource guide too.
That's great.
Yeah.
Yeah, I think I want to just make sure that when we talk about how to get started and what to do, I just want to say, that the most important thing right now is that we are all recognizing how social connectedness is a public health priority, and it's a tool for healing and rebuilding. And so we can really start by ceasing to think of social isolation as a personal problem and beginning to address its root causes with intentionality in the systems, the norms, the policies, and the historical injustices in our community. socially connected communities are healthy, resilient, and importantly, co-created with purpose. So investing in social connectedness is an investment in community health and well-being, and ultimately more and better opportunities for all. So we'd like to just thank you, Erica, for inviting us, and we look forward to hearing from everyone on the call.
Well, thank you so much, Risa and Eddie. Sounds like you guys have been really busy in the chat. Now, I've been a really good girl. I haven't been looking at the chat. I've been paying attention to what Eddie and Risa are saying, but it sounds like there's some pretty good conversation going on there. I am going to ask Erin to launch this poll because, first of all, I hope you enjoyed the discussion, but even more than that, I'm curious if you could adopt some of the strategies that Eddie and Risa shared in your community. So Erin, if you have that poll ready, go ahead and launch that. And your responses are anonymous, but just give us a yes, no, or maybe. We are not sharing the results with the audience, and we don't have, and there's no way for us to tell what your response is. We're just curious about whether or not you can do that. And after you respond to the poll, if you would please let us know in the chat, what challenges or obstacles do you think you may encounter by implementing any one of the strategies that was shared during today's discussion? So thank you for filling out that poll. And Erin, you can go ahead and close that now. I appreciate you, Erin. So now I'm going to look in the chat because I'm getting ready to transition to Joanne. So Joanne can lift up any questions that may have come through. Joanne?
Many questions. And as Eddie and Risa alluded to, just the topic and the presentation today really have people thinking. And what I love that I'm seeing in both the Q&A and the chat is that people are already working on this. So to Risa's point, this is not something new, but let's be more intentional about making sure that we're really creating social connectedness through policies and systems. So I think we're going to have time to get through some really great questions. I'm going to start with Risa, and Jimena asked a question kind of related to the definitions, and I think it's a good place to start. And just making sure we're clear about the difference between when we talk about social connection and social cohesion, or is it one and the same?
It's a really good question. Each of them do have, by different definitions. I see some similarities, and I know, Eddie, your team has been working on some globally consistent definitions. Do you happen to have the one for social cohesion or not? You're on mute. Yeah.
Of course I am. So no, we didn't tackle social cohesion at the Global Initiative on Loneliness and Connection. We did tackle social connections, social connectedness, belonging, social isolation, loneliness. So it's just another term that I'm sure we'll be looking at. But I would say, as Risa pointed out, social connection is really, there's a framework around this developed by Dr. Julian Holt-Lunstead that looks at various aspects of our ability to connect with others. So what are the functions of our relationships? What is the structure? How do I have connections or not? And what is the quality of those relationships within that? Social cohesion, in my mind, and I'd love to have a dialogue around it, might look at more norms around our societal impacts, our society context, around how connected we are to each other through a norms approach versus the structure, function, and quality of our relationships.
Yeah, making sure that becomes part of the culture of a community. Perfect. And I thank Jimena for that question because it was a really great one to start off. So Eddie, I'm going to stay with you, and then maybe Risa can chime in after that, because there's two questions, no surprise, about data and assessment. We expected this. And so Danielle wanted to know, are there any publicly available secondary data sources that you use to assess social connectedness at the local level? She says that social connectedness is a priority in Danielle's community in their health improvement plan, and leadership is requesting population data indicators to track progress.
Yeah, that's a great question. Actually, Risa and I were just talking about this with our teams just a few weeks ago. So yes, there are. And there are organizations like United Healthcare, Socially Determined, and others who are looking at community data. They're looking at various other data streams, looking at gaps in the structures of communities that may be leading to disconnection. So the structural builds of those communities. Are there food deserts also are linked to having social disconnection? So there's many data streams that are looking at the typical SDOH, social determinants of health risks of factors. And I think that gets to a bigger issue here, that social connection is really a factor that undergirds all of the social determinants of health. And so truly you can look at these other indicators where they're low, you will also see a corollary in social disconnection.
Yeah.
Risa, anything to add? Yeah.
Yeah, I mean, I think this is so many people are interested in this right now, so I'm glad this question came up. In fact, our local leaders network next Tuesday, we're going to have a couple of peers discuss how they're measuring social connectedness in community, including questions that have been integrated into community health needs assessments. Another one will talk a little bit about youth mattering and how they used a youth survey to access whether youth feel like they matter in community, and there's a correlation there. And then one of Eddie's colleagues will share some of what she's seeing are the tools that are being used either at a county level or national level. Lots of people questioning. Of course, there are tools used to look at loneliness, but as we mentioned earlier, that's a subjective sort of thing, and it's more about individuals in that way. And then, there's also ways that we can think about measuring social connectedness. I know County Health Rankings has some.
Yeah.
Do you want to mention that, Joanne?
So I want to invite Erica to chime in because this audience is very familiar with County Health Rankings. And remember, folks, that you can go to the rankings and look at the model and see where there are the indicators and measures, but they may be under transportation or housing or some of the other categories. But again, this is so integrated. And then remember, folks, what works for health? What works for health also has some practice tested, some evidence-based strategies for social connectedness but it may not be directly labeled as social connectedness. Do you want to say more, Erica, about what County Health Rankings has?
No, very well said. I will just point out the model really quickly here, and I'll share my screen.
That'd be great.
Yeah. So you see the model here, and what Eddie was saying was so true. And I'm see if I can blow this up. Eddie was saying that when you see people struggle in these focus areas here on the right, you will also see there's a correlation with their level of connection. That's so true. Social isolation really does feed and breed a lot of the poor health choices we make. It could be because of lack of transportation. It could be because we are just not connected enough to be able to make health choices. You will see that even where we talk about family and social support, we see that that's in that social and economic space. The reason why those things are in that social and economic space is because that means that what happens in that space will actually impact all of the rest of the health factors. So very much tied to the core of who we are and the health choices that we make. And I'll just pause there so you can take a couple more questions, Joanne.
Great. Thanks so much. That was very valuable to tie people back to rankings and the CHR&R model. Okay, Eddie and Risa. So this is kind of related to data, but more squarely about assessment. And so Diane just wanted, she said she's interested in assessment tools. And I know, Eddie, that's something your team has looked into, like what are the most common tools that folks can go to so they don't have to sort of rebuild some of those assessment tool questions.
No, I really appreciate it. So there are a number of tools. I think there's like 20. And I will also put that in the resource guide at the end. And they range from assessing social isolation to loneliness and the level of social connection that the user wants to dive into. The most common one is the UCLA 3-item scale. It has 3 questions. Looking at social isolation and loneliness. And it's the most widely used across the globe. And again, though, this is really looking at a personal level of the individual. Unfortunately, it's something that Risa and I are working on is really truly getting at, and her team, getting at what is a community's social connection scale or assessment might look like. And there are many that are pieces that we've just articulated, indicators, but we want to try to put something together that's more comprehensive. But I will be sharing the list of the 20 for you all, so you can have that.
Great. And Eddie, you talked about the importance of working with government, and one of the attendees says that they work in local government and they would personally like to see more support for social cohesion and social capital. And this person's bought in. But any suggestions for advancing this effort and getting buy-in at, the city manager or city council level, those policymakers?
Yeah, absolutely. So I will mention that there is work going on with the U.S. Surgeon General's office right now that is doing convening of mayors across the country, and we're supporting that effort, where we're looking at how do we drive these best practices into hyper-local community approaches. We're putting together roundtables around supporting those discussions and toolkits on how we can build local collaborations and drive these participations. So more to come in just the next few months on this.
Yeah, that's very exciting work. And I saw somebody drop Dr. Murthy's book in the chat, which was great. Okay, so switching gears a little bit, the impact of technology, social media, that type of thing was highlighted by Camilla, and she wanted to get your take, Risa and Eddie, about how can we actually leverage technology to foster connection and improve community belonging, particularly thinking about how some communities may be safer in online communities like youth and LGBTQ.
Yeah, Risa, do you want to go for it? I'm happy to.
I know you've got a lot of partners in this space, so go ahead and then I'll jump in.
Sure. So I think it's a great call out, and I appreciate the question, because I certainly don't want to overstate that all social media use or technology is bad. It's certainly not. For some communities, such as the persons with disabilities or even older adults, during the pandemic, research came out that they actually achieved greater social connection because of the virtual shift across the board, even in volunteerism over in virtual environments. So there was a positive impact for certain communities. I will say that one of the functions of the Foundation for Social Connection, which I'm representing, is something that we have called the Innovation Accelerator, which is supporting evidence-based practices and evidence-based technologies in this space. And so we've actually created and helped to support the development of 2 technologies that are online, for creating online connections and communities and skill development for individuals and communities to engage in a healthy way. So there certainly are ways to do that. And there are many technologies and many online presences being built to this aim.
Great.
Yeah, I would just mention, as far as equity goes, that's one of the reasons why broadband access has been mentioned multiple times in our presentation, and just the need, across the country to ensure some equity there, because that ability for people to be able to connect in with family and friends with technology is so critical, especially now.
Yep. Thanks, Risa. One thing I wanted to invite both of you to touch on is just the issue of intersectionality. So we're getting a lot of questions about, the specific subgroups that might experience social disconnection more than others. But I think it's really important for us to be aware that many people are not one thing, that they cross many of these groups. They may live in a rural community and also, be a person of color, or so can you talk about that? Because I think, some folks in our audience are going towards, well, what do we do for new mothers though? What do we do about people who can't vote? And so rather than, just comment on taking sort of a subgroup by subgroup approach versus how to kind of identify those intersectionalities and the sort of compound effect.
Yeah, we talk about that sometimes when we give this presentation and we list who is most isolated, we then further go on to say, so imagine if multiple things, living in a rural community, a person of color, LGBTQ altogether, right? So this notion that none of us are just one thing. And so when we really think about the levels of social isolation, that intersectionality is critically important. I mean, I go back to, co-creation with community, right? Going back to bringing people into this conversation, those who are experiencing social isolation for whatever reason they are, and having them be part of the conversation to understand, what would work best, for them and in the context of each community. Eddie, what would you add?
You took the words out of my mouth, and I think Risa and I both highlighted the need for co-creation and bringing in all of those communities, all of those populations into the discussion, not having a single stream approach for new mothers or a single stream approach for caregivers, but really bringing in the co-creation after assessing the needs of that community in the development of the approaches. That's how you get an intersectionality from our perspective.
And that's how you get connection.
Yeah.
By not addressing
Absolutely.
people in separate groups.
Yeah.
Perfect. So Erica, I think we do have to move on, but I want to say a couple of things in just a few minutes. One, folks are asking, they're saying this is a ton of great information. Folks, the recording of this webinar and the slides will be posted on the CHR&R website tomorrow. So check out the website tomorrow. The resource guide will be there too. And a lot of folks have been asking about saving the chat because folks are sharing resources with each other in the chat, which is what the discussion group is for too. So everybody come to the discussion group. But apparently you can't save the chat if you're a participant. So in the few minutes remaining in this webinar, we encourage, I know it's hard to kind of scroll back up, but if there was something you missed from another participant, be sure to try to get it back from the chat.
Yeah, I did not know that was a function you couldn't employ in webinar, but you could definitely save in discussion group. So if you can come to it, that'd be great. Thank you so much, Joanne, for facilitating that Q&A session. And listen, I promise you, I told you these folks knew a lot. So I kept my promise. There's just like so much in their heads and they can just spit it all out to you. So I thank you so much for all of that you're sharing, have shared with us. Now we would like to hear back from you, and Tommy's chatting out a link for a survey. Please let us know what you think about this particular webinar, but also the topics you'd like to hear. It's really how we plan our webinars. We want our webinars to be useful to you. So, and we do look at that feedback every time. I promise you that we have a group discussion every month, so about our webinars. So help us out. Now I want to kind of just set the stage for next month's webinar, which is going to be another good one, just like this one. Earlier Eddie was telling you about how he identifies with the isolation that happens because of what the trauma that his ancestors as Cherokee Nation residents endured. We're going to kind of delve into that next month because I want to just pull us back to what happened in May when the remains of more than 500 children who attended an Indian boarding school were discovered at burial sites. So the US government published findings around it. They actually did a study and published findings around it and confirmed that these were government sanctioned efforts starting in the 19th century to actually erase indigenous culture, just like Eddie said. Now, the consequences of this assimilation have been so profound that even today, our indigenous brothers and sisters struggle to thrive. We're going to talk about that next month. And I'm going to ask that you join us because in August, we're going to hear from two leaders from two indigenous communities. Lisa Wade from the Chickaloon Village Traditional Council in Alaska, and Tatewi Means from the Thunder Valley community in South Dakota will share how these communities are reclaiming cultural traditions and challenging systems that have led to oppression. The cool thing about it is that the lessons that they're going to share can be applied to any population experiencing health inequity. So you definitely don't want to miss this webinar. We're going to post registration for it, I think tomorrow morning. We're ready to post the registration for this one tomorrow. So you will get information probably in your, like your follow-up packet about how you could join that webinar. Make sure you do that. So right now, Tommy's sending out the information for the discussion group. I know Joanne's probably left to head on over. Please do join us so we can dig in and just pull out some more nuggets of wisdom from Risa and Eddie's heads. So join us in a few minutes. Tommy, go ahead and chat that out. And be sure to stay in touch with us through social media and by subscribing to our newsletter. So you can learn more about these wonderful webinars that are coming up, but also tools and resources that we have at County Health Rankings and Roadmaps. One of those such resources is In Solidarity. Don't forget about that new podcast that we now produce. This is where we have courageous conversations exploring how our lives and fates are interconnected with some of the nation's most forward thinkers. So listen to wherever you listen to your podcast and be sure to let us know what you think about it. I want to thank Eddie Garcia and Risa Wilkerson again for sharing their wisdom with us today. I also want to thank my production team for the hard work rather, in producing this webinar. I did not lose internet connection, so hey, got my fingers crossed that I won't for the discussion group. But most of all, I want to thank you for the hard work that you do every day to create equity in your community. So I look forward to seeing you in the discussion group and on next month's webinar. Have a good afternoon.